Hello, UCLA School of Nursing. I'm going to give you a brief walkthrough of the Nursing Diagnosis Handbook. This is the 12th edition. This will help you with those care plan nursing diagnoses at the back. So starting from scratch, you've never used this book before, you don't know nursing diagnoses yet, I would start with the index. Let's say your patient has something wrong with their liver. You can look under L for liver. And you will see liver biopsy, liver cancer, liver function, liver transplant, liver function impaired. So that's a nursing diagnosis, etc. Now, one that almost all of you are going to use at some point, if not every quarter, is going to be related to pain. Now, there's 3 different types of pain in here. There's acute pain, chronic pain, and labor pain. Unless your patient is about to have a baby, we're going to look at these other 2. And judging by the fact that we're in the hospital, I'm guessing this is a new onset pain, something sharp and uncomfortable, so we're going to go with acute. And I just want you to notice that page 655 is the starting point. Now, if you are familiar with that diagnosis of acute pain and you want to find the page number faster, you would go instead to the front of the book. And the front of the book lists all the nursing diagnoses right here and right here. And you see right here we have acute pain, chronic pain, labor pain, and so on. So we're going with acute pain, and it still leads us to page 655. There's another little section here, which if you have the physical textbook is bordered in green, and this helps you to find sort of related diagnoses. So you can see this section is the guide to nursing diagnoses. So if we go to P here, and we look at, this is more of a way to get from the doctor's diagnosis to a NANDA. So let's go back to our example from before of liver. Okay. So liver function. Here are some possible liver diagnoses, right? So we have liver biopsy, liver cancer, liver disease, cirrhosis, liver function, liver transplant. So these are possible diagnoses you might expect for a patient with this situation, if that makes sense. So you're not going to find a pain category, but you're going to find pain under a lot of these conditions. Okay, so let's go to pain, acute pain. So here we are at page 655, acute pain. This first section is a description of what this NANDA describes. So you look at this, make sure that this is appropriate for your patient so that you've picked the right NANDA. These defining characteristics are going to be things you might look at for your as evidenced by. These related factors are things you're going to look at as related to. You'll notice there's not medical diagnoses in here, and you're not going to put medical diagnoses in here. There's always a way to describe the medical diagnoses in terms of its key symptoms, like impaired liver function instead of liver failure or liver disease. Renal dysfunction rather than kidney disease, etc. Then here is a long-term goal. A long-term goal comes under these NOC outcomes. That would be something like control your pain, pain levels lowered, patient understands how to treat their pain, something along those lines. Actually, patient understands how to treat their pain would be more of an objective. So these are the objectives. Those are what you want to try to accomplish during your shift or in the short term. And they should be given a SMART goal outline. So they should have something that is follows the SMART goal. So there's a timeline, it's realistic, it's achievable, it's possible, all the SMART goals. Now we're going to look at the list of interventions. So after the outcomes and the objectives, you're going to look at the interventions. Here's a main intervention for pain is the delivery of medicine. So that's important right at the top. And then you're going to have additional interventions through here. Now in italics is the evidence-based justification why that intervention works. So you can use this book as your source for evidence for supporting your interventions. So this is a great resource. You can also look up the papers where they got this information. For instance, here's a citation inside the NANDA book. And the only thing I would say, I would warn you to not use sources that are older than about 5 years old. So probably better to use the book, which is up to date, rather than older citations. So there's a lot of implementations that can be done for pain management, as you can see. Find the ones that apply to your patient. Your patient might be pediatric, so you can use the pediatric specific ones if they work. They might be geriatric, they might have cultural barriers, they might be planning on going home and experiencing this pain in an extended way, so you might consider this area for finding things to educate them on. And there's also this discharge and planning section. These are good places to look for education interventions. And then every nursing diagnosis has a list of references at the end. So if you needed to find another source or find citations that had used that source going forward, that would be where to start. And then, of course, if you log into the VPN and go to the UCLA library and get on PubMed, you can find those papers directly. I hope this has helped. I hope you all do very well on your care plans, and best of luck.